Okay, we're here with Martin Girash, and you are the president of the board.
No,
chair of the board. Let's get this correct. Yep. Thank you. So listen, a couple of the people presenting tonight were pretty harsh on the LHIN, and we're accusing you of being derelict in your duty in terms of not supporting public engagement. How do you respond to that?
Well, our responsibility, as I said earlier, is in the program and service area. And in that area, we found that there was considerable public engagement. I don't think anyone has raised any objections to the programs and services that have been articulated. Most, if not all, of the concerns have been addressed around site selection. And in terms of site selection, as the Deputy Premier said when she was here, it's a local decision. When we reviewed, and we do have responsibility for ensuring that the process is a robust process. And when you review the process, as we did tonight, and we had prior to tonight, you can see that it was extensive. So it doesn't require that we actually do the community engagement, as long as it is done, to ensure that it's done. And we have ensured that it's completed, and it's quite robust.
And so how do you respond to the representative of camp who spoke very eloquently tonight and her demanding that the LHIN create opportunities for engagement on the site selection?
Well, again, the site selection is not the focus of our work. Our work is to ensure that the programs and services that are being proposed meet the needs, or services that meet the needs, and that the facility is able to provide the services to meet those needs. That's our responsibility. We've carried out that responsibility. Tonight's meeting is another example of listening to the various individuals who have concerns. And frankly, we did hear some issues tonight. One in particular that I'm quite interested in is the concept of services, community services throughout the county. Now, we heard about the Windsor Hospital system and community services there. We also are looking at community services throughout the county. For example, the nurse practitioner clinic in Essex. The family health teams, as you know, the LHINs are going to be involved in family health teams. So as we're looking at the entire project as a system project as opposed to a hospital site.
Right.
The hospital site is one component which is going to morph into something very different from what it's been in past decades anyway. And clearly we heard that tonight. So we have been studying this, we have been listening to people, we have been communicating with camp. Camp has been communicating with us for a year and a half. We've had an enormous number of emails back and forth. We know what their concerns are. We heard some more of them tonight, and some of them we're going to, we'll see if the board is going to consider them and see what we can do about them, particularly around the distribution of community services throughout the county. The issue of going to the hospital for everything is something that we know does not work. It's overwhelming our hospitals. Our hospitals can't cope. If you've been to an emergency department yourself, you know the kind of problem you face if you're not in a trauma situation. You see, you'll wait for 24 hours if you're not in a trauma condition. Who wants that? So if we can facilitate the designing of community services like the Urgent Care Center, like the Willette campus, like the Tafor campus, like the Nurse Practitioner Clinic in Essex, like the Canadian Mental Health Association, then that will ease the hospital emergency department so they can do what they are designed to do.